dive right in, shall we? Here's a tough one to get the gears turning. A nurse administers epinephrine to a patient experiencing anaphylaxis. Which of the following changes should the nurse expect? A. Decreased blood pressure. B. Decreased heart rate. C. Increased blood pressure. Or D. Increased respiratory rate. Hold your horses. The answer will appear in just a bit. Next up, another challenging question. A patient with a history of chronic obstructive pulmonary disease, COPD, is prescribed albuterol. What is the nurse's priority assessment before administering the medication? A. The patient's level of consciousness. B. The patient's heart rate. C. The patient's blood glucose level. Or D. The patient's potassium level. Now on to the answers. For the first question, the correct answer is C. Increased blood pressure. Epinephrine is a potent vasoconstrictor and increases blood pressure by constricting blood vessels. It also increases heart rate and dilates airways, helping to counteract the effects of anaphylaxis. For the second question, the answer is B, the patient's heart rate. Albuterol can cause tachycardia, so it's crucial to assess the patient's heart rate before administration. Moving forward, ponder this. A nurse is caring for a patient who was recently diagnosed with type 2 diabetes. The patient asks the nurse why they need to check their blood glucose levels at home. How should the nurse reply? A. To monitor for hyperglycemia. B. To monitor for hypoglycemia. C. To monitor the effectiveness of the treatment. Or D. All of the above. The answer is D. All of the above. Checking blood glucose levels at home allows patients to monitor for signs of both hyperglycemia and hypoglycemia, as well as to assess the effectiveness of their diabetes treatment plan. Lastly, consider this. A nurse is caring for a patient who is at risk of developing deep vein thrombosis, DVT. Which of the following interventions should the nurse include in the patient's care plan? A. Encourage bed rest. B. Apply warm compresses to the legs. C. Provide passive range of motion exercises. Or D. Administer prophylactic anticoagulant therapy. The answer is D. Administer prophylactic anticoagulant therapy. Anticoagulants are medications that help prevent blood clots, and they're often prescribed as a preventive measure for patients at risk of DVT. In summary, today's discussion revolved around various Nclex questions, focusing on different patient scenarios and the appropriate nursing interventions. The key takeaways from this session are understanding the effects of medications like epinephrine and albuterol, recognizing the importance of self-monitoring in managing chronic diseases like diabetes, and knowing the preventive measures for conditions like deep vein thrombosis. Remember, practice makes perfect. Keep challenging yourself with these questions and